I guess when I think about the kind of work that I'm drawn to when working with people with learning disabilities, I often think of, you know, maybe some of those difficult experiences of shame, stigma, powerlessness, and some of the problematic narratives that do follow people with learning disabilities. And I guess I'm drawn to maybe adopting kind of narrative ways of working, or looking at problems from a compassion focused lens, and really, trying to see if there's different stories around, or a more compassionate reframing of things. And I guess that ties in really nicely with the creativity that I like about working with people with learning disabilities.
There's such a variety in the work I do as a clinical psychologist working in services for people with learning disabilities. Therapy-wise, we integrate many ideas and models that we would consider and are evidence-based for all other people. CBT with a greater emphasis on behavioural and practical approaches, compassionate focused therapy, including some CFT groups that we've run in the service, ideas from acceptance and commitment therapy, in particular connecting with values and mindfulness, psychodynamic ideas, particularly supporting people with relationships and patterns of understanding relationships and dynamics, and understanding of attachment and trauma is key. Systemic ideas, questioning and techniques, working with individuals and with their families and carers and other professionals, and using positive behavioural support as an approach, and person-centred planning to improve quality of life and reduce restrictive practices and the risks and behaviours which may be challenging. Working with a range of potential mental health problems and difficulties. So I often say to people, it's like being a jack of all trades, it really is.
I do lots of different types of work. I do lots of complex assessments, gathering information from different places, different people, different sources, to develop an understanding of someone's distress and what might help improve their safety and quality of life. Models that I use often include kind of relational models such as cognitive analytic therapy and psychodynamic ideas, and systemic practice, often with families and teams. I also regularly use principles and techniques from cognitive behaviour therapy.
So I currently work in a specialist service for people with behaviours that challenge. So the framework that I use the most is trauma-informed positive behaviour support. However, I also do a lot of systemic work with families and with networks, and I think that's probably one of the most commonly used frameworks in learning disability services. When I offer one-to-one psychological therapy, I tend to use a CBT or a narrative approach. There's also a lot of assessment work in LD services, for example, dementia assessments, autism assessments, cognitive assessments, and I find that work really interesting as well.
In kind of the work that I do the most, that's a difficult one because I just do so many different things. So I do lots of assessments, so I might do IQ assessments, but I also do initial assessments face-to-face. I use different forms of psychometrics. I do lots of formulation, so using all different types of psychological models to help individuals understand what might be going on for them. I do lots of different interventions, so I can do PBS plans. I can also do one-to-one individual therapy. I can do therapy informed by family therapy or systemic ideas if I'm working with a staff team or a family. I do all sorts of different forms of evaluation, so I get self-reports. I also do different psychometrics. There's opportunities for research, I do teaching, there's just so much that I'm able to do. So in kind of the work that I do the most, I can't say there's any one thing I do more than anything else, because every single week there is something different that comes up that fills me with lots of excitement in terms of, I haven't done this in a while, I'm going to do this again. So I wouldn't say there's anything particularly I do more than anything else.
I think in our service, I probably mostly support people using a systemic framework. And although I offer one-to-one psychological therapy, often using adapted CBT approaches and other approaches, I think without systemic working, I can't do my client justice. So working in learning disabilities, often difficulties that come to psychology are more than just the person. They're affected and changed by all aspects of the system. To be honest, that's why I love working in this field. There's so much variety in who I work with. Sometimes supporting the system like families, carers, paid staff, to feel more confident in understanding an area in a more psychological way can have such a huge positive impact on the individual at the centre of that system, and something that I would never have got as an outcome without working in this way.
I think I've been pretty lucky in that respect. Whilst working with the MHLD, I had the opportunity to work with EIS. EIS is an emergency intervention support team that facilitated in the delivery of training programs for outside agencies to ensure that the client got the best care possible for their best interests. I think sometimes that was a challenging piece of work, not only because we were working with people who had never really thought about what it must feel like to not be able to communicate in a conventional way, but also making sure that they understood and then tried to get those support carers to think about it from the client's point of view. This would include teaching the support carers new skills to the use of instructions such as active support, where every moment has the potential for a meaningful engagement with the client, so the client felt valued and had a really good quality of life. And positive behavioural support tools like modelling, which included tools like guided assistance, where we would teach through role playing and getting the support carer to rehearse it and then give them feedback on it. Feedback would include things like getting the support carer to understand the service user's early signs of distress, what those early signs could mean, and how best to facilitate in the calming of those if and when those things happened. So a really challenging piece of work, but it was a very rewarding piece of work for me.
I think I've been pretty fortunate in my assistant post to have such a variety of opportunities. Under the supervision of a consultant psychologist, I've been able to run diagnostic assessments for both learning disabilities and for cognitive decline, which has required me to use a variety of psychometric tests, such as the Wrestler's Adult Intelligence Scale and other standardised measures. I've also incorporated psychological models to formulate and create interventions to reduce the stressing situations clients experience. This could be working in a one-to-one therapy situation or working systematically with parents and carers. In therapy sessions, I usually incorporate cognitive behavioural approaches, but I've also used attachment perspectives and third wave approaches, such as compassion-focused therapy in my work. My job also requires me to be part of a multidisciplinary team and work with other local services. Not only have I learned a lot from working with other professionals, but this also ensures that clients receive a holistic support package. Finally, I've been able to fulfil my passion for research by publishing papers and attending conferences.